Hello, this is Tracy Wallace, Director of Training at the California Family Health Council, and I am pleased to be your presenter for this learning session. This training session was developed by the California Family Health Council as part of the California Primary Care Association's Patient-Centered Health Home Initiative. CPCA's Patient-Centered Health Home Initiative is a statewide program to support community clinics and health centers in patient-centered practice transformation. More information on the Patient-Centered Health Home Initiative can be found at cpca.org. Today's session will be looking at the role of the healthcare team in providing patient-centered care. The session, entitled All Hands on Deck, will explore the following objectives: listing 2 strategies for effectively communicating with your coworkers, examining what positive communication looks like across the healthcare team, and identifying 2 steps your healthcare team can take to improve communication immediately. Let's take a quick review of what patient-centered health home is comprised of so that we understand the significance of the healthcare team effectively communicating with one another. The patient-centered health homes are comprised of comprehensive care, patient-centered care, coordinated care, accessible services, and the highest quality standards of quality care and safety. In terms of the role of communication between members of the healthcare team, this really falls under the component of coordinated care as one of the major areas of patient-centered health homes. Coordinated care, of course, includes the patient and their family, the dedicated staff, which comprise the care team, and other providers who may be external to the care team, such as hospital staff and other social service and medical agency staff. When we think about the coordinated care team, we must always remember the patient's needs come first. If the clinical team is communicating clearly to the entire team, this ultimately will lead to better patient outcomes. So in this model, we're presenting the flow of the patient's needs coming from clinical to the team to patient outcomes. We will explore during this learning session how the flow of information, support, and communication may go back and forth between different members of the team and certainly does not need to go in a linear direction. It needs to be effective, and in many cases that will look different depending on who the patient is and what their needs are. The bottom line is that all members of the team are working towards the best possible patient outcomes. Research shows us what patients want. They want to see the same provider, and they want to have clear communication with their providers. So in this webinar, we look at what clear communication really is. We define it, we look at strategies that make it work, barriers to breaking it down, and what are some easy, immediate fixes to improving communication between your healthcare team so that ultimately the patient is provided the communication that they desire. Members of the care team include the patient and the clinician, the medical and clinical assistant, the nursing staff, health educators, front desk staff, pharmacy and dispensary staff, referral coordinators, social workers and other social service providers, phlebotomists and other lab technicians, clinic managers, abnormal lab follow-up staff, and others. This list is certainly not exhaustive, and for every healthcare setting, the members of the care team may look different. One powerful dyad found in almost any healthcare team is the provider MA dyad. The two-person team addresses most routine patient needs, and when structured and trained properly, is an extremely critical part of the healthcare team. If the provider MA dyad is working effectively, it in many ways is telling of how effective the entire team is working together and communicating with one another. So I encourage you to look at your provider MA dyads in your healthcare setting. Are they meeting your standards? Are you happy with their outcomes? Where is there room for improvement? Team-based care includes a continuous relationship where roles and tasks are clearly delineated and defined, and maximizing flexibility among team members is crucial to helping the healthcare team be as productive, effective, and successful as they possibly can. One way to maximize flexibility is to cross-train staff so that staff can wear many hats and play many roles, which in so many healthcare settings is the case. But are people getting the formal training they need to provide the task associated with each role as effectively and successfully as they possibly can? Or are they just being asked to do extra work which they may not feel properly trained to perform, or may not feel properly acknowledged in the effort they're making to now expand their role in providing patient care? Team-based care really looks at the continuity of care. It's about making sure there's a link between the diagnosis, medications, referrals, consultations, and linking that back to the patient's lifestyles and habits. Information from one appointment or referral or consultation is transferred to the next, and the care is organized and planned so that today's clinical decision takes into consideration yesterday's care. Again, the team-based care approach is a constant flow of information and support from one member to the next. It's more circular than linear, and it may look different from patient to patient. Merriam-Webster defines communication as the process by which information is exchanged between individuals through a common system of symbols, signs, or behaviors. With this definition, I would hope that you would pause a moment to think about what are the symbols, signs, and behaviors that your team uses to communicate with one another. Is the communication being done in a way where the playing field is level? Is everybody communicating with one another using language and literacy levels that reflect the diversity of your healthcare team so that nobody is feeling left out or on the sidelines because they can't follow along with clinical terms or medical terms in a language that may be a second language they acquired later in life, and there may be some nuances or intricacies to the way things are being communicated that are foreign to them. Communication. Communication is about building understanding, trust, and ultimately positive patient outcomes. So who's responsible for all this communication? The team is responsible, the clinician is responsible, the medical assistants are responsible, the patient is responsible. Now, of course, under clinician and under medical assistant, we could stick many other job titles or replace that with many other players on the team. The idea here is merely that everyone plays a role in communicating, with the ultimate recipient of that communication being the patient. Communication is more than words. It involves facial expressions, body posture, the words you say, and the way you say them. Let's take an example of the way you say them. I think there are instances in the healthcare setting when someone with more training can be perceived as condescending or patronizing when speaking to another member of the team who may have less expertise and less knowledge and perhaps less understanding of a situation. So it may never have been the intention of that clinician to say something that was perceived in a condescending or negative way, but that is how it could be perceived by the person who's feeling that the information was not presented in a way that made them feel respected. So I ask you to really consider, are you speaking respectfully to each member of the team and speaking to them in a way that you would want to be spoken to? I think body posture and facial expressions are certainly something to be aware of. I think there are opportunities when doing staff development where team building exercises can be explored that really make this an interesting, fun exploration of how people communicate, where gestures are used and body posture is demonstrated, showing both positive examples and negative examples in an effort to get the whole team on the page and cognizant of how these are factors too in communicating with one another and in ultimately making the team work as efficiently as it can. There are some people, for example, that may have a natural tendency to put their mouth in a scowl, and it does not reflect some inner feeling of sadness or anger. And by making that person aware, again, in a situation where they feel comfortable and safe, so at some kind of staff development or staff meeting that's around exploring the issue of communication. And it can be in a gentle, supportive, lighthearted way be brought to that person's attention. Then there might be room for encouraging that person to put on a different facial expression, or encouraging that person to remind staff near them, I'm not sad, I'm not angry, you know, this is just who I am. So there is value in exploring this communication deeply with your staff so that a level of understanding one another, trusting one another, building rapport will enhance your communication and ultimately make your patients feel more comfortable. Clear communication requires talking to your team, and not just talking to them during a staff meeting or during some staff development opportunity, but talking to them regularly. Having opportunity to consistently talk to one another will provide you with the insight into how people like to communicate, what their style is, and figure out what's working and what's not working. Again, I've already mentioned the importance of using a language that everyone understands. How can you level the playing field? How can the clinician talk at a level that could be understood by somebody with a lot less training? And how can that person who maybe has some technical training they received in a medical assistant program be motivated, inspired, encouraged, and feel that they're in a safe enough environment to elevate the language that they use and be encouraged to communicate with the clinician in a way where everybody feels respected. Checking for mutual understanding is certainly critical. This is something you're probably already practicing with your patients, and you may not have thought to practice it with the members of your healthcare team, but I invite you to do so. And one of the easiest ways to do this is to ask. Evaluate with your members of your team. Do you understand what I'm saying? Can you explain back to me what I've just explained to you? Provide important messages and information verbally and in writing. This takes into consideration that people have different ways of learning. There are people who learn better through hearing, learn better through reading, learn better through doing, and there are many people who do best when a combination of approaches are used. Clear communication. This also includes making eye contact, having an open body posture, which says, I'm comfortable, I'm willing to hear you, I respect what you're saying, not too close, not too far. That's something in our culture to be aware of. If you have staff members who may be from another culture, there may be something here that you want to explore, that somebody may be feeling uncomfortable if they're being approached and the other person is too close to them. It may make it hard to have effective, positive communication. Being sensitive to one another's needs. This again goes to the issue of literacy, language. There may be some other kind of challenges that an individual is faced with around having any limited hearing or limited vision. And so if you're presenting them information and you're trying to communicate in writing or verbally, be sensitive to who's on your staff and what needs they may have. Clear communication also comes into play when we think about selecting forms to use. We want to take time to explain how to complete a form correctly. We do not want to make assumptions. Maybe it took you no time at all to understand how to complete this form. We want to give adequate time for staff to adjust to new forms. Select forms which will improve efficiency. This is really important so staff don't feel that their time is being wasted, which ultimately can erode away morale. And ask team members for their feedback on the forms you've selected. Ask them what they like about them, what they don't like about them. What are their suggestions for improving these forms? Clear communication includes applying active listening techniques, such as paraphrasing, reflecting, and parroting. It includes asking open-ended questions. Pausing is good too. Silence is okay if you're listening to another member of your staff. It's hard to listen if you don't stop talking. And paying attention to nonverbal cues. Those can be extremely helpful. And you might want to encourage your whole staff to pay attention to one another's nonverbal cues. It gives you a heads up as to whether or not somebody's understanding you, somebody's interested in what you're saying, and somebody's paying attention. Clear communication will ultimately influence how comfortable everyone feels in your practice. Next, we're going to explore what does positive communication look like and what are some barriers to achieving it. Positive communication is critical from the beginning. It helps to set the tone for the patient's visit. Imagine a patient walking into a healthcare setting where the front desk staff is yelling down the hall or behind the front desk area to another staff member in a tone that sounds disrespectful, that sounds like there's some language barrier, somebody's saying something and the other staff member is saying, what, I don't understand, or can you say that again? Or somebody saying something that sounds rushed and the other person has a facial expression or some nonverbal cue that indicates they were spoken to too quickly and they didn't comprehend everything that was being said. Your patient is going to take this all in, and that is going to be their very first impression of your healthcare setting. So this positive communication tone that's set from the very beginning is key, not only for your staff to work effectively and to help them do the best possible job they can do, but to help your patient feel comfortable. It builds trust and it ensures that everyone is being understood. What makes it hard to communicate clearly with your team? I know I've referenced this a few times already, things like there's a language or literacy barrier, but there are some other clear barriers that are worth exploring. Some of these barriers may be time. So if your healthcare setting is like any other healthcare setting you find in this country, people are rushed, things are happening quickly, there isn't always time taken and pausing and clear explanations given because people don't feel that they have the luxury to do all of that communication, to practice the best possible communication skills available. Slowing down, pausing, leaving room for questions, giving one another plenty of time to say, I don't understand, or checking in, did you understand? Can you repeat back to me what I just said about how the patient needs to take the medication once they get home? So time, how can you work with your staff to take a little pressure off of them so that they feel that they have the time to be understood and communicate in a positive way? Can you is it simply enough to allow them the time to say, we value positive communication, so slow down, take the time, check in with one another and make sure you're understood? That could be one way of handling it. I'm sure there are many others. You need to think about your healthcare setting and your healthcare team and what might work best for you. Assumptions about clarity. I mentioned this already when I talked about the forms and how you certainly don't want to assume somebody knows how to fill out a form correctly. We don't want to do any assuming when it comes to communication. We want to clarify. And one of the best ways we know to do that is to ask the open-ended question. Can you tell me how to do the following? Can you show me how to take the medication correctly? Can you describe to me how the patient needs to prepare for this procedure? So assumptions should go out the window, and lots of open-ended questions should be part of how your team communicates with one another. Unclear delineation of roles is certainly a barrier to communication. Somebody thought somebody else was going to do something, and the other person thought that other person was going to do something, and then in the end, something gets missed because people were not clear on whose role it was to communicate with the clinician, the patient, the lab tech about some aspect of that patient visit. Don't fall into that trap. Clearly define the role of each member on the team. We have a few slides that give some examples of the role of each team member, but of course in your healthcare setting it may look very different, or one member may wear many hats, and in that case it's critical that these roles are defined. Say them verbally, put them in writing, and give lots and lots of reminders. Are there other obstacles that exist for you and your team? I encourage you to think about what those might be. Effective communication. There are lots of things that can get in the way. There are personal feelings that people have when they come to work on a given day, or that creep up throughout the day based on somebody's buttons being pushed, or a text they just received from a boyfriend or a girlfriend, or a patient's case that is really causing them to transfer a lot of their feelings of anger or sadness onto other team members around them. There's defensiveness, there's bad moods, there's judgments, gossip, and assumptions. All of these can really break down communication. And nobody is immune to having these communication breakdowns occur at times. Everybody's allowed to have a bad day. Everybody's allowed to have a moment where they're not at their finest in the way that they communicate with a coworker. So let's allow for that. But what can you do to create an environment where people feel that it's okay to be who they are, but that these types of behaviors are not going to be tolerated? Gossiping, defensiveness, and judgment, for example. I would say supervisors have an opportunity to model positive communication. And if they fall into demonstrating communication in one of these ways that's less effective, which of course on occasion they will, supervisors are human too, then acknowledge it, own it, be aware of it. Say you're sorry and move on. Demonstrate that, role model that it's okay to make a mistake and to communicate in a way that is counterproductive. Acknowledge, I'm having a bad day, I'm not feeling well today, I shouldn't have made that comment, I shouldn't have snapped like that, that wasn't okay, I apologize. So let the supervisors be outstanding role models as to how to acknowledge when we make decisions about communication that are not helpful to the team, and that we can acknowledge it, we can own it, we can apologize, and we can move on. We're going to talk on this next slide about some great strategies that are easy to implement, could be implemented immediately, that can really help the overall communication of your healthcare team. If you're already doing these strategies, that's great. This could be a quick reminder and a validation that you're on the right track. If you're not, I encourage you to take a look at this list and start with one and see if from there, if it's successful, that would be a good strategy to continue, and try some others from the list. See what works for your team. What's going to enhance your communication? So the first bullet item is set aside specific time for team discussions. So this is not just discussion on a patient. This is not just discussion on a new health center protocol or a new HR policy. This is specific discussion around communication. This is where people can use the time to share stories about communication that are working, and stories about communication that are not working. You could say it's an opportunity for people to vent, to say, you know, I'm feeling misunderstood. I'm feeling like the communication is not two ways. I'm feeling like the communication is not respectful. And make sure from the get-go staff know that if there's venting or discussion around communication that is not positive, that this is a safe environment, there will be no negative repercussions, and that their comments are welcome. But make sure as time is allotted for a review of the types of communication that is working as well. You want to create a balance. You don't want staff to leave from some staff meeting just having used the time to focus on something negative or something that's not working. So craft the time into your agenda for a review of what's working and what's not working with the overall communication of the team. And this is where I would really encourage you to do something like a team building exercise to develop that trust and that rapport. Again, if your team feels comfortable with one another, if your team can communicate effectively with one another, your patients will sense that, and your patients will feel more comfortable. A huddle is a great strategy too. A huddle is different from time set aside for discussion. A huddle can often be spontaneous and quick. A huddle may be in response to an incident that just happened in the waiting room, for example, where there was an explosive patient who was extremely hostile in the way they were speaking to staff and acting towards staff. And staff need to be reassured that their supervisors and the higher-ups in the healthcare setting understand that that was a difficult situation, acknowledge it, and support the staff in having the feelings that they have. Give them an opportunity to go get some air, to take a 5-minute break to regroup, to just acknowledge that it was a difficult situation. And that's just one example where the huddle might come into place. Communication does not work effectively if things are just brushed under the rug, including interaction with one another and with patients. So if there is a moment in the healthcare setting where things get really heated, have the huddle, acknowledge it. Let people know they're safe to have their feelings there. Give people a chance to communicate with one another and move on. Assure them that there will be time set aside in the near future where there can be a greater debrief and a greater exploration of the situation to explore perhaps how that situation could be avoided in the future. Let people know that you care and that they're being heard, that their feelings and their needs are being listened to. That is all part of communication. Staff development, of course, is always a great idea. Everybody can use more training. Nobody knows how to do it all. In this case, staff development based on what your staff says they want more training on, what they want to know more about. That, again, helps them feel heard. If they feel heard, they're more likely to communicate openly with you. They're more likely to feel respected. That's going to increase the overall effectiveness of the communication between the team members. Recognize useful communication. There's a way to publicly praise somebody or acknowledge them when you like the way that they communicated in a given situation, either with a fellow coworker or with a patient. People respond to having their good deeds be recognized and to receiving praise. So to kind of recap these strategies to improve communication, you want to ask staff for their feedback. Again, this could be done in a staff meeting. It could be done through a comment box. It could be done through sending out a survey monkey where you ask staff for what's working and what's not working, And what are their suggestions for improvements? Reinforce positive patient interactions with public praise. That could be as small as just making a comment that's loud enough for coworkers to hear, to as grandiose as a whole wall dedicated to the employee of the month who's having the most positive communication with their coworkers, and a picture and a plaque and a $10 gift card to Starbucks. Or there's no limit to how creative you can get in how you want to publicly praise and acknowledge the positive communication. Managers and supervisors, of course, with everything else on your plate, this is one more piece that really should be considered. It's your role in modeling what positive communication looks like, what it sounds like, and doing the best possible job you can with it every single day, acknowledging the days when maybe you've done less than a stellar job, and saying you're sorry and moving on. In this next section, we're going to look a little closer at some examples of the role in communication that each member of the healthcare team has. And this is important because clearly defining and delineating the roles will support effective communication and ultimately patient outcomes. If everyone thinks that someone else is doing something, then nothing ever gets done. So we're going to start at the front with the front desk staff. What is their role? Again, these are just examples. It may look different in your healthcare setting. The list may be shorter, it may be longer, but for the purposes of this learning session, let's look at what this slide covers and use this yourself as a point of reference for how effectively and efficiently is your front desk staff communicating with the rest of the team. Is the front desk staff playing a role in making sure that the patient sees the right team member? Of course, the patient may be coming in for the stated reason for the visit, but as they come to check in, there may be some other very visible physical condition that the patient's presenting with that is certainly not reflected in the reason they came in for the visit. So the front desk staff can observe this. They can certainly ask the patient about it. And through this process, they may be able to redirect the patient to seeing a different team member on that visit, or at least notifying another member of the team that there may be other reasons why the patient came in for the visit. The front desk staff can remind patients of other appointments or prescription refills that may be needed. So rather than just assuming that the clinician or the MA is going to catch this in the chart, or that it's going to just be a standard part of the questioning that goes on during the visit, the front desk staff can ask the patient about this, remind the patient about this. And it's certainly okay if the front desk staff person does this, and the MA does this, and the clinician does this. There's no problem in the patient hearing this information more than once. The front desk staff can report to a medical assistant when a patient mentions something at the front desk that might be significant. A patient tells you as they're checking in, I'm feeling dizzy, or the patient is walking in limping, and the last time they were in for a visit, they were not. A patient, for example, arrives with a visible injury. The front desk staff person can ask the following question: can I know where you got care for that injury? So I may request the records for your clinician to review. This is about empowering the front desk staff to communicate. Their role does not need to be solely clerical. Clerical is really important, and admin support, of course, is critical to the flow of the patient. But encourage your front desk staff to communicate, to open their mouths, to ask questions of your patients, and to communicate their findings back to the other members of the team. Share the workload. The more information that each member of the team can get and can pass on to the next member, the better the care that patient is ultimately going to receive. The medical or clinical assistant, again, this list we know for the most part goes on and on and on and could have 20 separate bullets. So these are just some examples of the role of the medical assistant. There's the pre-exam services they provide. They check in and room a patient. They make sure the medical record for the patient is open and as updated as possible. And they provide patient with an estimated wait time when possible. During this whole pre-exam period with the patient, just like with the front desk staff, the MA has an opportunity to get information from the patient and to pass that information on to the provider, to note it in the chart, to document, and to speak up and communicate. Written and verbal communication about anything the patient has shared or something you've observed, even if it's completely different from the intended reason for the visit, is going to ultimately give the provider more information to work with and get the patient the care that they really need. The post-exam from the medical assistant perspective may include providing follow-up instructions to the patient and performing all follow-up duties as assigned. Now, follow-up instructions to the patient certainly cannot be provided by an MA if the MA wasn't communicated with clearly in the first place from the clinician. This is where that provider-MA dyad is so important. Does the provider understand how to communicate clearly with the medical assistant there to support them? Are there any language or literacy barriers? Is that MA more likely to understand something in writing than verbally? Is the MA empowered to ask questions, to say, can you repeat that? I don't think I understood you completely. Or will the MA feel like there's some repercussion? Somehow they might lose their job because they're appearing to be unskillful or unequipped to handle what's being asked of them. Encourage questions. Empower staff to communicate when they don't understand. And explore with them, what do they think a better approach would be? Clinicians, for this example, we talk about their role in providing patient care as indicated, including specialty care depending on the patient's diagnosis or condition, to communicate clear follow-up instructions with the appropriate healthcare team members responsible for patient follow-up. Managers and supervisors, their role, among many other things, is to oversee and update patient protocols. Again, if these updates are being presented to the healthcare team in writing, is there also adequate time set aside to present them verbally so that each member of the team who may do better learning using a certain learning method is able to give their full attention and fully absorb the information that's being presented, and communication is being encouraged so that that healthcare team member can ask questions about these new policies and protocols. The manager and the supervisors will model positive communication when regularly meeting with team to review patient protocols and share relevant information. But beyond just the times when there's scheduled meetings for reviewing patient protocols, there's interactions between managers and supervisors and other healthcare team members all day long. In each and every one of those interactions is the most positive, effective communication being provided. Is that manager or that supervisor doing their best each and every day to model this behavior? And again, acknowledging where they might have a shortcoming on a particular day. Other team members, Their role, among many other things, may be to provide patient care as indicated, so based on a referral they received, and to communicate back to the team what are the follow-up instructions. This can be one of the trickiest areas for positive communication, because if you're working with providers or provider staff that are not part of the regular team, these are external players, there might not be the same rapport, level of understanding, trust, or safety in asking questions if one does not understand the directions they're being given that the team would have with their internal coworkers. So be very cognizant of the fact when you ask somebody on your team to call a doctor so-and-so outside of your practice, or to follow up with an agency outside of your hospital, that this is where we can run into some real communication barriers, and people should be encouraged to slow down, to take the time, to ask the questions they need, to get things written and spoken so that there is no sense of misunderstanding that happens. Written instructions, verbal instructions, in a language that people speak, using simple, easy to follow terms. All of those are going to help with positive communication. Consider ways other than conversations to communicate with your healthcare team. So one way certainly is written communication. We've presented that idea a few times already throughout this session. Effective written communication with the healthcare team can be just as important as verbal communication. And it's okay to repeat yourself. It's okay to put something in writing, to say it verbally, and to do that back and forth until you feel like everybody hears what you need them to hear. Again, keeping in mind that some people are going to learn better reading something, while others are going to learn better hearing it, and others may need to just do it a few times with the support that it's okay, yet again, to ask questions. We're going to look at a few case studies before we end the session. This first case study is regarding the front desk staff coming in contact with a patient and what role they can play in communicating what's being observed with the other members of the team. So a patient comes in for their uncontrolled diabetes. The front desk staff person checks in with them. How are you doing? How are you doing with your diabetes? I know it's been a struggle. What's happening with your diet? And the patient proudly tells the front desk person, well, I've given up candy. And the front desk staff person appraises that patient and acknowledges their efforts. That's terrific. But as that patient goes back to their seat, the front desk staff person observes that she's putting away a bag of chips. So what is this front desk staff person to do with this information? Does she or he say nothing? Does she or he confront the patient? This person, if encouraged by their supervisors and other team members, should certainly notify somebody about the discrepancy in the patient's story. So if the patient goes into the visit and reports to the clinician that they really are cutting candy out of their diet, and the clinician has no knowledge of the fact that they've just put away a bag of fried potato chips, then they can't properly provide the patient the care that they need in terms of further nutrition counseling and supporting that patient in their efforts to change their diet. So encouraging the team to notify a provider either verbally or in the chart if they hear a discrepancy in the patient's story is really part of positive communication. In this next case study, The situation is that a patient is speaking to the medical assistant as she's getting her vitals taken, and she's in for a refill of her hypertension medications, but she mentions to the MA that she wants to talk to the clinician about why she can't get pregnant when she's been trying for 3 months. In this instance is when we want to make sure that all members of the team are encouraged to tell patients they should be speaking up. So this is about encouraging communication between the patient and the clinician, initiated by another member of the team who tells the patient, you know, it's a great idea to talk to the clinician about this. The clinician would be happy to help you with this if you let her or him know that you have this concern. So you really want to encourage your team to support a patient when they mention speaking up about a health concern or question unrelated to the stated reason for their visit. In this final scenario, again, this is a patient who shares this concern with a health educator because they are continuing to have asthma attacks, although they have received medication and an inhaler. So the patient has several asthma attacks a month, but is complaining that the inhaler that you gave him doesn't work. In this scenario, what can the health educator get from this patient to make sure they're getting the proper care? This health educator can be empowered to get as much information as possible from the patient and to document this information when appropriate. So in this case, you'd want your health educator to feel empowered to communicate with the patient about the inhaler. Ask the patient, can I see the inhaler? Can I see you use the inhaler? Because the patient may need very different care if the issue is that the inhaler is not helping control the attacks versus the issue is that the patient's not using the inhaler correctly. So by empowering each healthcare team member to ask questions, to communicate directly with the patient, not to assume that another member is going to ask questions about the patient's practices and lifestyles, ultimately is going to lead to the best possible patient outcomes. I want to thank you for participating in this learning session. I hope that you have found it useful, and please check back with CPCA for any of your training needs.